Hi everybody, my name is Haley Wilding and I'll be talking about visual impairments. This really interested me because I have a visual impairment. I wear glasses. So what is a visual impairment? Um, it's been defined by multiple different things. This is the best definition I could find, which is an impairment in vision that, even with correction, adversely affects a child's educational performance. Terms include both partial sight and blindness. So visual impairment doesn't necessarily mean that the student has blindness. It could just mean that their eyes are beginning to change, and so that they need the glasses in order to help correct that. So what are the causes and why do some people have visual impairments and why some people don't? There's many causes on why. I picked out a few of them that I thought were pertinent to us as teachers and educators. So sometimes they're inherited conditions like retinitis pigmentosa, RP. It's when the child or student is born with normal vision, but as they go through childhood and adolescence, their vision slowly decreases and they lose their peripheral vision to where they're only looking through this tunnel of vision. They only see about this much, about 20% of what we see with our normal vision. And then everyone's heard, or most likely heard, about near and farsightedness, where they can either see far away or close up, or they can, and they can't see the other one. Sometimes infections cause it. Sometimes when children are born, they get a bacterial infection or a viral infection that affects their eyes, and they lose their sight. This is amblyopia, or something that we know it by is lazy eye or squint, and that's something very common in children. They have different things that they come up with to help with that. Or injury to the eye. Sometimes students or something are out playing and they get something caught in their eye and it damages the cornea, and that will cause them to lose their eyesight. And everyone's heard that it's all fun and games until someone loses an eye, which is true, because once you lose an eye, game over for that eye. Okay, so how can we as educators recognize it in our classroom? I think that's a big thing that some educators struggle with. So sometimes the students will close or cover one eye to try to focus in better on what we're saying or what we're presenting. They could squint, and because of that, they'll probably frown because they can't see what you're trying to teach them via the board or presentation. They'll complain. Children and adolescents usually are very vocal about what they can or can't see, or what they can and can't do. Assuming that they're vocal, or they'll just remain quiet and they won't say anything. They'll have trouble reading or doing any other close focused work, so they have to hold the object super close to the eyes. And I really like this picture because it demonstrates the squintiness of the eye, the frown, holding it up close to the eye, and then the blurry background. So this probably would be what a student would see if they started to develop a visual impairment. The board would be very, very difficult to see, and they wouldn't be able to take notes or do anything like that. There's a couple other ways we can recognize it. They'll blink more because they're probably trying to clear something out of their eye, and they'll like continue to blink, and that blinking might cause the eyes to be more watery. And when the eyes become more watery, the eyelids maybe puff up and look a little bit more red, swollen, and then those tears from the watery eyes, they will dry and look like crusties on the eye. So those are some things that we can be more aware of as teachers, as our students are developing and changing. So the medical world has developed about 3 different eye tests to help diagnose visual impairments, especially for like near and farsightedness and glaucoma, which is an eye condition where pressure in the eye is built up. Not many children and adolescents have glaucoma, so that's why I didn't focus on it very much in this presentation. So everyone's probably seen these. This is called the visual acuity test, and it's where you're at a certain distance and the eye doctor asks you, okay, what can you see? And it's graded on how far you are away from it and how far down you can get. The highest score is 6 out of 6. And that's probably what you want to aim for, but I can't make it, so. And then second one's called a visual field test. That's where you look into this machine and lights will start flashing in your peripheral vision. So it will it's testing if you can see to the side. And then the last one is called tonometers. And this is the one that tests for glaucoma. So you put your eye on this machine and you open it and they tell you not to close it. And it shoots this puff of air into your eye, measuring the pressure of the liquid in your eye. Okay. So knowing that and how to recognize if students are having visual impairments in our classroom, what kind of adjustments can we make to help them to better learn in their class? If you have a student that is completely blind, you need to provide material to be transcribed into Braille for them. And it's best to do this at least 2 weeks prior. That is the minimum amount, so that they can be included in the learning process as well. Provide verbal explanations of your audiovisual presentation. So like what I'm doing right here, I'm showing the presentation, but I'm also describing what's on the slide as I'm going along. And if they just can't see, if their eyes are just starting to go a little bit fuzzy or a little bit blurry, invite them up to the front row and say, hey, if you can't see what's on the board or on my presentation, come up and look at it. Like, it's okay if you have to walk up. I have to walk up all the time to see the presentation. And there's a couple other things we can do. We can just let them be independent. They're students. They can be strong. If we continually give them things, they'll develop a learned helplessness and they won't be able to function as adults. And I think the most important thing is this last one, is to treat the student the same as any other student. And as you do that, the other students will begin to treat their classmate as just a regular classmate, and they won't think of him or her as anyone different. They'll just include them and ask them for things. And so you're setting them up to succeed and not to fail, so that they can be contributing members of society. And in conclusion, I just want to end with this quote. Jacqueline Paulding was born blind, and doctors thought that she wasn't going to go anywhere, kind of like Helen Keller. Like, she was not going to be able to walk, not going to do any of these things. But in an article she wrote for parents who have children that are born blind, she said, blindness is not a disability or a defect, but a characteristic. So blindness or visual impairments, they're part of who your student is. You can't change it. All you can do is help them to embrace it and make themselves better because of it. And that's my presentation. I really enjoyed studying this topic, and I hope you actually learned something from it. I know I did.